Hello everyone, welcome back to the channel. This is part 14 of the ongoing IV lecture series. In every video, we break down 10 essential frequently asked questions to help you ace your exams with confidence. Today, we have an excellent mix of infection control, pediatric dentistry, oral surgery, and dental materials questions. Make sure to pause the video at each question, try answering it yourself, and let's see how many you get right. So let's jump straight into our first question. Steam sterilization for standard wrapped up instruments. Options are A. 134 degrees for 20 minutes, B. 134 degrees for 3 minutes, C. 141 degrees for 15 minutes, D. None of the above. So the correct answer here is A. 134 degrees for 20 minutes because it ensures absolute safety for wrapped instruments. While standard unwrapped tools can be sterilized in just 3 minutes at 134 degrees Celsius, wrapping them changes the game. The protective layers of pouches or wraps creates a barrier, meaning it takes extra time for the hot steam to deeply penetrate the packaging, heat up the metal, and completely destroy any hidden microbes. Giving it a full 20 minutes guarantees that the steam does its job thoroughly through every single layer. So let's check out the next question. Here we are moving on to pediatric dentistry space management. So the question is, patient is 4 years old, premature extraction of second primary molar, when to place the distal shoe. Options are A. Immediately after extraction, B. Wait until healing of socket, C. Wait until eruption of permanent molar, D. None of the above. So the answer is A. Immediately after extraction. So a distal shoe is a space maintainer used when a second primary molar is lost before the first permanent molar erupts. We place it immediately for a very important reason, to guide the unerupted permanent tooth safely into its place. If we wait for the socket to heal, the gum tissue firms up, making it much harder to slide the appliance gate plane down into the bone. Even worse, the teeth nearby can quickly shift, closing up the gap. So placing it right away keeps the path perfectly clear. So now let's look at an emergency management scenario. Patient having periodontal uncontrolled diabetes. How to manage? The options are A. Antibiotics, B. Analgesic and antibiotics, C. Incision and antibiotics and refer to physician, D. Don't do anything, it will resolve. So the answer here is C. Incision and antibiotics, then refer to physician. So, when a patient has an acute periodontal infection alongside uncontrolled diabetes, we face a double challenge. First, we must urgently control the active infection. Draining it via incision and prescribing antibiotics is crucial because their compromised immune system struggles to fight pathogens. Second, we must refer them to a physician. Diabetes and periodontal disease share a bidirectional relationship. Severe gum infection spikes blood sugar and high blood sugar worsens gum disease. We cannot truly heal their mouth until their systemic health is stabilized. So it's a team effort. So next is a highly tested oral surgery and pathology concept. Most common cause of TMJ ankylosis. The options are trauma, arthritis, rheumatoid fever, none of the above. So the correct answer here is A. Trauma. Trauma, especially a fall onto the chin during childhood, is the leading cause of TMJ ankylosis. When an injury occurs, it can cause bleeding inside the joint, known as hemarthrosis. If left untreated, this blood turns into a fibrous scar, which gradually calcifies and fuses the jawbone to the skull. While systemic conditions like arthritis can also damage the joint, physical trauma is by far the most frequent culprit behind this jaw-locking condition. Catching and managing joint injuries early is the best way to keep things moving smoothly. So now back to pediatric clinical decision making. Our Fifth question is child with deep cavitated primary molar, slight mobility and furcation involvement. What is your treatment? A. Pulpotomy. B. Extraction. C. Pulpectomy. D. None of the above. So the correct answer here is B. Extraction. While we always try our best to save primary teeth, furcation involvement combined with mobility means the infection has traveled deep between the tooth roots and severely damaged the supporting bone. At this stage, pulp therapies like a pulpotomy or pulpectomy simply won't work because the surrounding foundation is compromised. Leaving a chronically infected tooth in a child's mouth poses a serious risk to the developing permanent tooth bud sitting directly underneath it. So removing the tooth eliminates the infection completely and keeps their future smile healthy. So now let's review core dental material properties. Our sixth question is all are GSC properties except A. Release fluoride. B. Increase remineralization. C. Reduce oral pH. D. None of the above. So it's an easy question. The correct answer is reduce oral pH. Glass ionomer cement is a fantastic tooth-friendly filling material. Think of it as a tiny rechargeable battery for your tooth. It constantly releases fluoride and helps rebuild and strengthen the enamel through remineralization. However, it does not reduce your oral pH. A reduced acidic pH is actually the bad guy that causes cavities. Instead of making the mouth more acidic, GAC's fluoride release helps protect teeth against those dangerous acid attacks. It's a cavity fighting superhero, not an acid maker. So, next up is a crucial ethical and legal question you are guaranteed to encounter. So, let's check out. A child with trauma brought to the clinic with his teacher. You tried calling the parents, but no answer. What will you do? A. Ask consent from the child. B. Refuse treatment. C. Wait for parents. D. Ask teacher to sign consent, taking parental responsibility. So the correct answer is D. Ask teacher to sign consent, taking parental responsibility. So this is a really important ethical point. As healthcare professionals, the safety and well-being of the patient are our number one priorities. Refusing treatment or waiting unnecessarily when a child has experienced trauma could cause more harm. In emergency situations, if parents or legal guardians cannot be reached, the adult with immediate legal responsibility, in this case the teacher, under the principles of in loco parentis, can provide temporary consent to ensure the child receives urgent care without delay. We must always act in the child's best interest. So let's look at clinical protocol for managing systemic conditions. So our question 8 is control diabetic patient taking his insulin regularly needs extraction. You instruct the patient before the treatment to A. Stick to normal diet. B. High sugar intake. C. Skip insulin. D. Skip meal. The correct answer here is A. Stick to normal diet. When treating a well-controlled diabetic patient, the ultimate goal is maintaining stability. You want them to take their usual insulin dose and eat their normal meals right before the extraction. If they skip a meal but still take their insulin, their blood sugar will plummet, risking a dangerous hypoglycemic emergency right in your dental chair. Conversely, skipping insulin or overloading on sugar will spike their glucose levels, which impairs healing. Keeping their regular routine unchanged ensures they stay safe, calm, and metabolically stable throughout the procedure. So question 9 deals with precise clinical timing in pulp therapy. So let's check out. For approximately how much time is 4% glutaraldehyde applied over pulpal stumps after soaking with cotton during pulpotomy? A. 5 seconds. B. 30 seconds. C. 2 minutes. D. 4 minutes. The correct answer is D, 4 minutes. So during a pulpotomy procedure, once the damaged coronal pulp is removed and bleeding is controlled, we use a 4% glutaraldehyde solution. Applying it for a full 4 minutes is the specific technique used to effectively fix the remaining pulp tissue. Unlike older agents that cause deeper, potentially irreversible changes, this specific application time creates a surface zone of fixation while maintaining a vital, healthy pulp tissue underneath. So aiming for long-term tooth preservation and healing. So 4 minutes is the exact sweet spot. And our final question for today covers operative dentistry scenarios. You accidentally didn't bond the itched enamel in a patient. With good oral hygiene, what will happen? A. Deposition of enamel organic sulfates. B. Enamel will regenerate in 7 days. C. Enamel will continue to decalcify. D. None of the above. So the correct answer is B. Enamel will regenerate in 7 days. Don't panic if this happens clinically. Acid itching simply creates microscopic pores by removing minerals from the outer enamel layer. If it isn't bonded or covered with composite, the tooth has a built-in defense mechanism, saliva. In a patient with good oral hygiene, saliva constantly washes over the area rich in natural calcium and phosphate ions. Within about a week, these minerals plug back into those microscopic pores, completely remineralizing or regenerating the tooth surface back to its healthy hardened state. So, typically saying saliva saves the day. So, and that brings us to the end of part 14. How many did you get right today? Drop your score down in the comments below. And if you have any questions about these concepts, let's discuss them there. If you found this video helpful, please hit that like button, subscribe to the channel, and turn on the notification bell so you don't miss part 15. Keep studying smart, and I will see you all in the next video. Good luck with your preparation. Thank you.